The following is a paid commercial program paid for by Arkansas Spine and Pain. The opinions and views expressed in this program belong to its sponsors and are not those of this station or their affiliates or their employees.
We're talking about the opioid crisis today in the studio. Joining us is Dr. Alaya with Arkansas Spine and Pain. Thank you for being here today.
Thank you for having me.
We hear about the opioid crisis often, but yet there is still no answer. And definitely there's no stop to it. Give us a brief summary of what this means to you.
Yes, Lauren. Obviously, this is an extremely broad topic, but all this started in the middle 90s with the marketing of OxyContin that created a terrible problem of addiction. Thank God in 2000, they started to see the red flags of the multiple overdose events that they were having, and all that evolved until nowadays.
And it just snowballs.
Exactly.
So at your clinic, what are some of the things that you treat, and what are the most common things that you treat?
Well, we treat basically low back pain, neck pain, we do spine intervention procedures to treat. Also, we treat chronic pain syndrome. But believe it or not, those pain issues can be treated without opiates.
And some people may say, how? Or tell me more.
Well, when the opiates come into play is because patients claim that they need something stronger to control their pain, to modulate their pain because they cannot function and they cannot do their daily activities. But in reality, when this happens, it's because it's not just an organic pain involved. It's also a psychological component that is compounding the problem even worse and makes a chronic pain.
So what treatments have you found most successful for your patients that come in?
Well, if we are going to be treating chronic pain that involves psychological issues as well, we need to have a multidisciplinary team that includes the doctor, the psychologist or psychiatrist, and a physical therapist. The other things that we do to take care of the organic pains, we can do steroid injections, we can use different other modalities to help the patient to heal and improve in their pain.
You say organic pain. Tell me what you mean.
Organic pain, it's something that happens to your body. Let's say you have a surgery, you have postoperative acute pain because of the surgery, you had a car wreck and you broke a bone. Whatever cause that is hurting or traumatizing your body that generates pain, it's organic pain. Now, when the patient doesn't have a healing process, the normal healing process happens, and then the patient continues to hurt after that normal healing process. That is chronic pain. And that's when the emotional and psychological components come into play.
You told me a number earlier, the percentage of opiate deaths across the globe.
Yes, we talk about two very interesting figures. What really was alarming, in 2017, we knew that 75,000 Americans died because of the misuse of opiates. And even more alarming than that is the fact that among the global production of opiates in the world, 80% of that production comes to the United States. The only 20% is used to treat the pain in the rest of the world. And the more worrisome thing is that in America, we're only the 4% of the inhabitants of this planet.
Wow. Thank you, Dr. Alaya. In 2017, 75,000 Americans died from the use of opioids. And listen to this, 80% of all the opioids in the world are consumed right here in the United States. If you are suffering from chronic pain and would like some more information on treatments that don't involve opioids, any information that you may need, give them a call at Arkansas Spine and Pain. The information is on your screen. We'll see you next time.
Visit one of our convenient locations in Whitehall, Benton, Conway, Jacksonville, Little Rock, and our new location in Searcy.